Madam President, I'd like to talk about another topic, and I'm sure it's no surprise to anybody that it's been more than a month now since the embarrassing website rollout of the President's health care plan, and it still isn't working. The Obama administration's been forced to take down the website on numerous occasions and often didn't work at the critical moment when they were trying to explain how it was finally beginning to work. And while reports have surfaced showing only 6 people managed to enroll on the first day, the administration still refuses to put out any real numbers about how many people have actually signed up for coverage. I've sponsored a bill demanding we have more transparency and more answers about how this $400 million has been spent on an exchange that wouldn't work. 3.5 years to get ready. Interjecting ourselves into 16% of the economy and everybody's health care coverage, and still not working. The administration acted surprised. President Obama claimed the system was temporarily overwhelmed by a large volume of interested shoppers. Another person in the administration estimated that there might have been hundreds of people on before the website crashed. In a time like this, the website crashing for any reason is really not a very good excuse. Prior to the launch, HHS officials had insisted that the exchanges were on track. They insisted that they had been tested, insisted that it was working the way it was supposed to work, just like people are now insisting that the President's health care plan is going to work the way it's supposed to work. At recent committee hearings in the House, Marilyn Hanover, the Administrator for the Centers of Medicare and Medicaid Services, and Secretary Sebelius each testified they were confident that these glitches, as they called them, would be improved by the end of November. These are the same people that were saying it would work the 1st of October. And it's long overdue for the President and the administration to just be level with the American people about this. It's also important to understand that the website is the easiest thing that they're going to be asked to do. The President recently said during his White House Rose Garden speech, Obamacare is not just a website, it's much more. Well, I couldn't agree more. I couldn't agree more. And I will say again, the website is the easiest thing that they will be asked to do, the easiest problem they'll be asked to solve. It should not become a proxy for whether this plan can work or not, and I think most Americans are going to figure that out. Like Senator McConnell, who was talking earlier about the Kentuckians he's heard from, I've heard from all kinds of Missourians who are seeing their hours of work reduced, their health care premiums rise. We know this is not going to be a good thing for the workforce. We've seen too many people responding with part-time work and trying to keep numbers under 50 so they don't have to comply with a law they think they can't comply with. In 2009, President famously promised, if you like your health plan, you can keep it. If you like your doctor, you can keep your doctor. He was still saying that in 2012 when he said, if you already have health insurance, you can keep your health insurance. Unfortunately, that's not the case for the 3.5 million people in the individual market who have already received letters that they're not going to be able to keep their health insurance. The Washington Post fact-checker gave the President 4 Pinocchios for his repeated pledge that you could keep your policy if you have it, and maybe that's because 5 Pinocchios aren't possible. 4 Pinocchios are the most they give for a statement that just turns out not to be correct. NBC News reported last week that 50 to 75% of at least 14 million consumers who buy their insurance individually can expect to receive a cancellation notice. Now, the administration comes up with something like, well, this is only affects 5% of the people in the country. If it affects your family, it affects 100% of the people at your house. And if 5% of the people in the country are 14 million people, and whoever's insured under their policy, we shouldn't act like that's no consequence at all. It's no surprise. They had plenty of time to prepare. The Springfield News Leader, my hometown paper, recently reported on Becky Stupak, who's 63. She suffers from blood clots and had insurance through the Missouri high-risk pool. Now, one of the things that Republicans wanted to do, the conservatives wanted to do when this bill was passed, was figure out a way to expand these high-risk pools. The idea that there were no other ideas out there is just wrong. And the Missouri high-risk pool, like all the others, goes out of existence December the 31st. Becky's insurance has been costing her monthly premiums of around $650 a month. Remember, she's got a pre-existing condition. She hadn't had insurance before she got in the high-risk pool, but she was in that pool. It was serving her needs. Now her insurance, she's been told, will cost her $1,043 a month, a $400 increase on a working salary, and that would allow her, she hopes, to keep the same doctors that she has now. One of my constituents said his wife, who had a pre-existing condition, will lose her policy the same way. Thanks to what's happening here, they don't know if they can get more coverage or not. They're going to have to close the high-risk pool, look for coverage other places, and it's almost certain that coverage is going to be higher than they've had, and almost certain to have less coverage than they've had. Greg, a pastor from Poplar Bluff, Missouri, said he received a letter from his health care provider of over 10 years announcing that will no longer be his health care provider as of January 2014. He was happy with his old insurance. He's now forced to find another plan. He wants to know why they cancel, and the only explanation he can get is the machine that says, due to health care regulations, they're being forced to drop some of their older clients. Sarah in Hannibal comes from a family of quintessential small business owners. In their business, they've been affected. If their business had been affected, their choice would have been to close businesses. She recently received a letter stating that after this year, her current choice of policies won't be available. So it turns out that it's actually only the White House that likes your plan if you get to keep your plan. This idea that you should just shop around, the idea that it's going to be less expensive, just doesn't work. Wall Street Journal this morning talked about states that are beginning to tell insurance companies, no, you really need to offer these policies for at least another 3 months. And if in California, if their insurance commissioner's right, 3 months of additional offering of the 115,000 policies that have already been canceled would mean that those policyholders could save as much as $28.6 million in 3 months. So whoever thinks these costs are going to go down, apparently the insurance commissioner in California says costs for these people are going to go up annually by over $100 million. Maybe that's why we're going to find out a lot more once the website starts working. In Missouri and in all states, we're seeing more Americans receiving cancellation letters announcing their dropped coverage. Some people will also be forced to pay higher premiums. I think we're going to find that most people are forced to pay higher premiums. Now is the time to work together. Now would be the time, I think, to start over and come up with good plans that would make the best health care system in the world work better. As my colleague from New Hampshire, Senator and a mom, Senator Ayotte has said, as maybe only a mom can say it, it's time for a timeout for Obamacare.